Here to discuss this and our other health headlines all the way from the Rocky Mountains is internal medicine physician Dr. Lipi Roy. Dr. Roy, welcome back. Always good to see you.
Oh, so wonderful to see you. And yes, I'm at a medical conference. I presented 4 lectures in 2 days here in the Rocky Mountain National Park.
Well, we're so lucky to have you. Thank you for making time for us. Let's talk about this latest COVID variant responsible for 85% of cases in the U.S. as of late September. What do we need to know about the Stratus variant, Doc?
Yeah, so we know that SARS-CoV-2, the virus that causes COVID-19, mutates frequently, creating new strains that are often more transmissible. As you pointed out, Hena, this current COVID surge is driven by this mutated XFG variant, aka Stratus, which is part of the Omicron family of variants, and it's spreading rapidly worldwide. 85% of cases, as you pointed out today, up from only 3% back in May, and it is the dominant variant. What's interesting is that this XFG or Stratus variant has unique mutations in its spike protein, which may help it bind to some of the cells, including respiratory cells, and cause infection. But the good news, Hena, is that the World Health Organization has deemed the public health risk of this Stratus variant, to be low. So while it can be highly contagious, this clinical manifestations or symptoms aren't as severe. But this rise in cases is concerning, as many Americans are confused about eligibility of the COVID-19 vaccines amid shifting guidelines, which could make it harder for certain groups to get the vaccine, like children and pregnant women. Hena.
No, you're right. That is certainly adding to the confusion out there. Doctor, what are the signs and symptoms to keep an eye out for this specific strain?
So the symptoms are actually, the constellation of symptoms are quite similar to the previous Omicron variants of COVID. So fever, chills, sore throat, runny nose, nasal congestion, shortness of breath, headache, fever, as I mentioned, fever, headaches, body aches. You might have heard this razor blade kind of sore throat. So painful sore throat is actually not unique. Other COVID variants have caused it, but this kind of razor blade, so hoarseness and soreness may also occur as well.
All right, we will keep an eye for that. Moving on to another outbreak making headlines. The Minnesota Department of Health is reporting 10 new cases of measles just in the last month, 18 cases so far this year. What's behind this outbreak?
Yeah, so look, as you pointed out, nearly a dozen cases of measles are caused by the virus rubiola reported by the Minnesota Department of Health. What we know so far is that all infected individuals were unvaccinated against the measles virus. 7 of the cases, these individuals traveled within the U.S. and 3 traveled internationally. School staff are implementing proactive measures to mitigate the outbreak. I want to make sure your viewers understand and really know that measles is a highly contagious airborne infection caused by, as I said, the rubiola virus, which can stay in the air for up to 2 hours after the infected person leaves. Symptoms to look out for: fever, rash, cough, runny nose, watery eyes, and people might think, oh, it's only just, measles is just a fever and a rash. I want to make sure your viewers understand that severe cases include pneumonia, respiratory distress, hearing loss, seizures, brain infection or inflammation known as encephalitis, brain damage, and death. So it should be taken very seriously. Public health experts think that the rise in measles outbreaks kind of nationwide is because of more and more people not getting the vaccine against measles, Hena.
So, Doc, with all that said, how do we protect ourselves from measles?
So really, getting the vaccine is the way to keep ourselves protected. But also, if you are someone you know or love is immunocompromised, could protect them through distancing, through masking. But really, vaccine is the #1 way to keep ourselves protected, Hena.
Dr. Roy, we always love you coming on the show. Thanks for making time with us. Enjoy the Rocky Mountains, my friend. Thank you again.